Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Today is World Health Day, and the theme for 2021 is Together for a Fairer and Healthier World. What does this mean? To tell you more about it, I'm joined by Dr. Farwa Rizvi. Hello, Farwa, and thank you for coming to the show.
Hi, Saliha. Thank you so much for having me on the show. Thank you.
It's a pleasure. I'm very excited.
Thank you.
We've been talking about it for a very long time.
Absolutely. I'm looking forward to that.
So, before we start talking about health and especially women's health, can you tell us something about
Yeah,
yourself, please?
sure. So, Saliha, as you know, I am a medical doctor. I've been practicing overseas back home in Pakistan as a physician, but very early on in my career, I ventured towards the public health. और I think मेरा शुरू से एक motivation था कि even I became a doctor because that was a stepping stone towards something greater. I wanted to go into research और मुझे लगता था कि like I've always liked to go for a hybrid model जहाँ पे मैं clinical side का काम भी करती रहूँ, but the research aspect of that clinical work always excited me. It wasn't just कि जब मैं doctor बनी थी तो उसके बाद मैंने अपना career थोड़ा सा research की तरफ किया and I went for a postgrad. I was working for some sort of research surveys and participating in epidemiological surveys, maybe right from second year and third year of my medical college. So वहाँ से शुरू हुआ सारा journey, and then after like a few 2 3 years I decided to go towards public health. I did my masters in public health, and many years के बाद जो है career थोड़ा सा change किया, and I started working in population. Started working in an international organization, Population Council. Say I started my career, and I think that was a turning point in my career where I was working as a doctor, but then I was also venturing into the research part of it. And ज़्यादा उसका जो मेरा focus था, it has always been for women's health and women's reproductive health. But उस वक्त थोड़ा सा I was venturing into different aspects of the research modules and everything. And that was the start of that journey. Um, उसके बाद मैंने थोड़ा सा academics में भी dabble किया, and I started working for there's a Royal College of Physicians and Surgeons in UK, and they have the regional offices in Asian countries. So I was working with them till the time I came to Melbourne in 2015 when I worked for a clinical cancer trial, and then after a year, I finally started my PhD in June 2017. And I'm really happy to tell you that I've just finished my journey. I finished with my PhD in February this year. It's been a steep learning curve. But what I'd like to tell you about myself is that although I've been working hard as a doctor and as a medical researcher and a public health person, I have loved other extracurricular activities. I'm a movie buff. I love my science fiction movies. I love horror movies. I love to watch really different genres of movies. And more than that, I love painting.
Wow.
Um, the first time it started doing the oil painting, I remember I was in class 3. My mom used to do a lot of oil painting. And मैंने अम्मी से पूछा कि क्या मैं कर सकती हूँ? I remember I had a small board and I made this picture of this, Heidi. It's a classic English novel.
Yes,
And I
yes, I
made
know how.
yeah, yeah. I just kind of painted the outline of that, and I still remember I doing some mountains, and I was so proud of my work as an 8-year-old. And I think I never looked back. So I painted water painting, oil painting, to the point that मेरे घर में सिर्फ मेरी अपनी paintings लगी होती हैं कि मेरी अम्मी की लगी होती हैं. So my mom is still painting. I had to stop 5 years ago because I moved to Melbourne and then I started my PhD, so everything was put on hold. And
Now you'll start again.
I hope to rekindle that romance between myself and the painting again.
You also said you write.
Yeah, I do. Like I used to write a lot. Different opinion letters, different story. I mean, with school, it started with small short stories, and then but more than that, my sister was into writing. I was just into more of the creative arts. I think anything, just sharing riddles or jokes or small stories or stuff like that. But then eventually मेरा focus ज़्यादा like obviously पढ़ाई तो थी, but painting was my main passion after that, and sports of course. So it
Of course.
was tennis and netball and my passion for that. And earlier we were chatting about horse riding, and I was telling
I
you that
know.
I was that one
I rode
person.
a horse. Yes.
I don't know either. I mean, I loved having playing sports, but horse riding wasn't my cup of tea.
It wasn't mine either. I've come back with huge bruises, two
I'm
hours
actually
of riding Mr. Bell. I
wow,
wasn't told who Mr. Bell was. Mr. Bell was this old 17-year horse. His actual name is Missed a Bell. So
wow,
because he missed a bell, and well, I was riding him. He's supposed to go straight. He goes right. He goes left, and I'm screaming. But I'll
honestly,
show you
Sadia,
some
I'm very impressed.
photos. But
I'm really
anyway,
impressed that you were so brave. I'm really impressed.
I think I was more embarrassed than brave, but that's okay. It took me 2 minutes to get on top of the saddle, and a friend of mine actually took a video of me, and
Oh
but
God.
yes, I did it.
But you know what? You did that. That's the most beautiful thing. You actually did that. Yeah. I think
Okay.
yeah.
So, Farwa, today is World Health Day.
Yeah.
What would you like to tell our listeners?
Yeah. So, Salia, as you know, the theme for this year's World Health Day is towards a fairer and healthier world. I mean, इस स्लोगन पे दो बातें जो बहुत स्टैंड आउट करती हैं, फेयर वर्ल्ड दैट मीन्स जस्ट वर्ल्ड के सबके लिए बराबरी, और हेल्दियर वर्ल्ड कि हमारी जो अभी सेहत है उसको हम किस तरह से बेहतर कर सकते हैं. मैं इसमें थोड़ी सी दो चीजें और ये डालूंगी कि हम लोग हमेशा बात करते हैं जेंडर इक्विटी एंड इक्वालिटी की. वो
Yep,
फेयर वर्ल्ड के अंदर एज इट इज आ जाता है फॉर एवरी बॉय एंड गर्ल, फॉर एवरी मैन एंड वुमन. It has to be a fairer world with equal human rights. So technically, we're talking about global accessibility to human rights.
yep,
And then, of course, in human rights की जब हम बात करते हैं तो सबसे पहले आपका health का एक concept आता है कि फिर healthier world that means कि every individual, regardless of the caste, ethnicity, country, background, socioeconomic, whatever, they have an equal right to good health. If you look at that, the health की जो the perfect definition है, it says the complete a complete health is a mental health, physical health, psychological health, and social health. तो जो सब sorry, जो सब spectrums हैं, पैरामीटर्स हेल्थ के, वो सब उसकी एक होलिस्टिक हेल्थ की अप्रोच के अंदर आ जाते हैं. तो इट्स अ ब्यूटीफुल स्लोगन, इट्स अ वेरी आइकॉनिक theme. It's a very important day, and fingers crossed that we, slowly and steadily move towards that. There are enough people, जो कि policymakers, researchers, public health people, and other people associated who want to have a healthier world, and there's work being done about it. But the thing is, जो जो जरूरी बात है जिसके लिए मैं फोकस करना चाहूंगी कि it's not just them, it is us as an individual and then pulling हमारी सारी efforts, all of them together.
thank you. So, what is the Sustainable Development Goal set by the UN on
Yeah,
reproductive health?
right. So, Saliha, Sustainable Development Goals have been proposed by the United Nations. 2015 में सबसे पहले इनका endorsement हुई थी, इनका concept आया था. But इससे पहले कि I talk about them because they're very very pertinent in relation to World Health Day today. मैं थोड़ा सा इसका हिस्ट्री के बारे में बात करना चाहूंगी.
Sure, yeah,
So from sorry, yeah, I'd like to talk about the history of
yeah,
World Health and reproductive health. So basically, World Fertility Surveys and basic general health का सारा जो है 1960 से concept आना शुरू हो गया था 1960 से, and then people were very much getting aware of the accessibility to health and women's health, safe motherhood, वो सारे concept आ रहे थे. And 1984 में जो है DHS, the Demographic Health Surveys, जो कि डिजाइन होते हैं बाय यूएसएड, यूनाइटेड नेशंस एजेंसी फॉर पॉपुलेशन डेवलपमेंट, उन्होंने ये सारा डिजाइन किया, जो कि हर 4 साल के बाद अराउंड अराउंड द वर्ल्ड 94 कंट्रीज 92 कंट्रीज में ये इम्प्लीमेंट होते हैं एंड ये बहुत बड़े बड़े नेशन वाइड सर्विस होते हैं जिसमें 60-70,000 पीपल डिपेंडिंग ऑन द कंट्रीज पॉपुलेशन ऑफ कोर्स anywhere between 45 to 60,000 people men and women aged between 15 years to 49 years उनका सर्वे किया जाता है to have an idea of the general health of the population न्यूट्रिशन के इंडिकेटर्स क्या हैं और एक कंट्री के लिए डेवलपमेंट का पता चल जाता है कि वो किस मरहले पे खड़ी है um, Having said that, the first really important conference happened 1994 में. लोग इसको कायरो कॉन्फ्रेंस के नाम से पहचानते हैं. It's called ICPD. That means International Conference for Population Development. The reason, Salia, I'm mentioning it here is because that ICPD conference in 1994 was sort of like the first time कि individual human rights की बात की गई और women's rights की बात की गई for reproduction and for reproductive health कि क्या औरतों को भी हकूक मिलने चाहिए to have good reproductive health. चूंकि ये कायरो भी इजिप्ट में हुई थी so a lot of the countries endorse that concept और उसके बाद जो है because we're trying to focus and I'm trying to talk about the countries the developing countries जो कि साउथ ईस्ट एशिया में हैं तो इन सब कंट्रीज ने उसको endorse किया था उस कॉन्सेप्ट को और हर इंडिविजुअल कंट्रीज में जो कॉन्सेप्ट है working towards maternal health and then working towards reproductive health for women वो आहिस्ता आहिस्ता they started working on that. उसके बाद जो है Millennium Development Goals भी आए 2000 में but then finally the United Nations proposed they endorsed a goal called Sustainable Development Goals जो आप मुझसे बात कर रही थी they were endorsed in 2015. Their global goals they have 17 goals actually जिसमें से
17.
yeah 17 goals to be achieved before 2030 United Nations ने जो propose किए हैं around the world, a lot of the countries in the first world and in the low to middle income countries they have endorsed those goals. Um, program implement करने के लिए. The most important thing is that these sustainable development goals actually, as the name suggests, ये बात कर रहे हैं for the sustainable development. चूंकि हम वर्ल्ड हेल्थ डे की बात कर रहे हैं एंड वर्ल्ड हेल्थ डे में वी जस्ट टॉक्ड अबाउट having human rights and accessibility to health. So these SDGs actually are a conglomerate of the goals to be achieved for reduction of A, poverty, B, economic development, C, reproductive health care, improvement, and just, removing all the barriers for any individual to access the healthcare. तो इसमें जो सबसे जरूरी बात है जो चूंकि हम लोग विमेन्स रिप्रोडक्टिव हेल्थ की बात इस वक्त कर रहे हैं और विमेन्स राइट्स की बात कर रहे हैं जो कि इट्स अ ह्यूज पार्ट ऑफ ह्यूमन राइट्स सस्टेनेबल डेवलपमेंट गोल्स और एसडीजीज इनको हम बोलते हैं एसडीजी गोल जो है 3 and 5 ये वो दो पर्टिकुलर गोल्स हैं आउट ऑफ द 17 गोल्स जो कि पर्टिकुलरली फोकस करते हैं ऑन विमेन्स रिप्रोडक्टिव हेल्थ अगर मैं आपको थोड़ा सा और ज्यादा अनपैक करती हूँ उनको तो SDG 3 जो है that talks about accessibility of women that means anywhere from 15 साल से 49 years जो कि WHO की वर्ल्ड हेल्थ ऑर्गेनाइजेशन की एक एज है फॉर रिप्रोडक्टिव चाइल्ड बेयरिंग एज फर्टिलिटी वाइज तो ये सारे जो गोल्स हैं इसमें सॉरी द गोल नंबर 3 दैट टॉक्स अबाउट द एक्सेसिबिलिटी ऑफ women to modern contraception effective contraception और जो गोल 5 है you'll be very interested to know कि उसमें it talks about the percentage of women in a country and then in a region जिनके पास autonomy है या decision making power है to actually choose a good effective modern contraception of their own volition अपनी मर्जी से
Which is
so they have
something we still
this
don't have among South
they still
Asians.
don't have that. So we're talking about personal autonomy and the reproductive health autonomy, which honestly, you're right, we still don't have that in so many countries around the world. And also, there's a part of that, जो कि एक indicator है to prevent child marriages and forced marriages and early marriages. Now, I'm not going
Which
to
we
talk too
still
much
don't
about
have.
we don't have that. And unfortunately, you and I know that there are so many countries, especially in the Southeast Asian
Yours and
region, which
mine are
may
one. Yep.
exactly your and mine are one जिसमें teenage girls are married off and
Yep.
15
Forced to
साल
get
पे 16
married.
साल पे
Yes.
शादियां by the time they're 19 or 20-year-olds they've got 2 children and they're still expecting the third one and which is a shame because all I'm going to say right now for the early marriages is that we're talking about child brides that means कि हम child brides जो हैं बच्चियां जो दुल्हनें बनती हैं that means that they don't get to have physical care they don't get to have the development because वो अभी 20 साल की भी नहीं हुई हैं. They're a teenager and they've been married off. Sometimes to even older people, sometimes it is forced, and cultural सारी pervasive cultural implications हैं. Jiska you and I both know, it is sort of like a Pandora's box. Maybe some other time we could discuss that, but all I'm going to say is that those teenage marriages are so scary and so dangerous क्योंकि वो early exit from schooling हो रही है उन बच्चियों की. हम लोग बात करें for adolescent marriages. I'm also going to talk about the early marriages in even the early 20s, because when you talk about youth, the actual technical definition of youth is anywhere from 10 साल से 24 साल. तो हम लोग समझते हैं in our countries as well कि जी 20 22 साल is the right age for marriage. Having
Yeah.
said that, that's still a very early age for a marriage for a girl. एंड हम लोग बात कर रहे हैं कि उनकी एजुकेशन खत्म हो रही है. अगर वो टीनेजर है तो उनकी स्कूलिंग खत्म हो रही है. दे डोंट हैव एनी एक्सेस. They're forced to be at home and do the domestic chores, which is sort of like a cultural expectation for those young brides to just take up the household chores. And then the young women, they can't go to college. If they don't have a college degree, for life, they'll be dependent on their husband, which would lead to a financial dependency, translating into a reduced personal and reproductive autonomy. So it's like sort of like
It's a vicious
Saliha,
circle.
it's a vicious cycle. Exactly, it's a vicious cycle which feeds on itself until the time we don't break that cycle. वो हम लोग अचीव नहीं कर सकते सस्टेनेबल डेवलपमेंट. तो वो
Which
बहुत
is
एक
why
बड़ा.
we are having this conversation, you and I. Every
Exactly. So that is
conversation
one part.
is
Yeah,
serious.
that is one part of it. उसके अलावा जो है सालिया दो तीन चीजें मैं और मेंशन करना चाहूंगी कि when we say reproductive health, that means कि उसके अंदर तीन कॉन्सेप्ट हैं जो बड़े इंपॉर्टेंट हैं. एक है unintended pregnancy, जिसमें मतलब ये है कि a girl or a woman of reproductive age group, which could be anywhere from 15 साल and onwards, didn't really want the pregnancy. Now we know कि ये
Let's
बहुत
talk
common
a
बात
lot
है.
more about
Yes,
that.
and we never talk about it. Culturally क्या होता है कि when there is an unintended pregnancy, उसमें भी दो types हैं. Maybe the woman wanted a child, but she probably wanted to wait for like 2 years or 3 years, and maybe she wanted a baby later on. She didn't want it right now. Now that is called a mistimed pregnancy. And sometimes there are women who just don't want any children or any babies, and they get pregnant because they can't use any contraception for so many reasons that I'll talk about later. And they that is called an unwanted pregnancy. So these mistimed and unwanted pregnancies हैं, they're both lumped together and they call unintended pregnancy. And there are, Saliha, so many barriers for women. You would be surprised to know that every year, अगर हम सिर्फ teenagers की बात करते हैं, in Asia, in Southeast Asia, 23 million pregnancies are just unintended, just like that. I'm not even talking about the unintended pregnancies in the women in their 20s and 30s. And you know, we have a huge cohort of that as well. तो मैं आपको एक स्टेटिस्टिकली सॉरी बताना चाह रही हूँ बात कि how
23
important.
million.
It's a huge number. And then I can tell you this example that last year से हमारा जो COVID ये शुरू हुआ है, and of course we'll talk about it later, because women weren't having enough accessibility to effective modern contraception. तो statistically ये लोग बात कर रहे थे कि 15 million pregnancies extra होंगी in terms of having being unintended. They were never wanted. It is a huge dilemma. It needs to be solved if we talk about having a sustainable health and equal human rights and accessibility to health. Then first of all, we need to unpack this and prevent the unintended pregnancies.
And
Um, Also,
teach everybody, especially women.
exactly. Especially women, but also the men, because it has to be a universal
Yes.
health education program, जो कि हर adolescent लड़के लड़की आदमी औरत को पता होना चाहिए. Exactly. The other thing that I wanted to talk about, there's a terminology called unmet need for contraception. That means कि बहुत सारी situations ऐसी होती हैं जिसमें लड़कियां and खवातीन they want to use contraception, and for maybe delaying a pregnancy or not wanting a baby, but they can't access that. So those women are, although uh, um, mentally prepared to use contraception, but they can't because of financial barriers or reduced autonomy, which we've talked about. So that unmet need is actually measurable. So we use that as an indicator in a country. to know कि कितना ज़्यादा reproductive health खराब जा रही है. तो ये जो सारी दो तीन concept हैं
There's also
unintended
a religious
pregnancies.
aspect to it. I mean,
Yes, yes,
we know
yeah,
Catholics cannot use
yeah,
contraceptions.
yeah,
So,
yeah,
whether we talk whatever
yeah,
religion we talk, there are
yeah,
always these barriers
yeah.
and religious
And
issues.
it's sort of unfortunate that the young women and the women in their 20s and 30s and 40s, especially the women in their 20s and 30s, उनका basic human right जो है for using contraception वो ही उनसे ले लिया गया है. They don't want to have children and yet they're forced to be pregnant and to have repeated pregnancies. I'm talking
Carry on the
about,
family name.
yeah, I'm talking about multi-parity. Like even for my PhD research work when I was working on one of the countries in Southeast Asian region, the thing is सालिया के जो unintended pregnancies हैं वो बहुत ज़्यादा dependent हैं on unemployment. जो मेरे results आ रहे थे show कर रहे थे, and across that region unemployment, low personal autonomy, और वो औरतें जिनका ऑलरेडी दो दो बच्चे हैं तीन तीन बच्चे हैं चांसेस आर कि वो और उनकी अनइंटेंडेड प्रेगनेंसीज होंगी. तो वो इट्स लाइक अ सॉर्ट ऑफ लाइक a domino effect. A woman who's repeatedly getting pregnant, she will keep on having children because there is no end to it. And it's just really sad. Hopefully, we can do something about that.
Hopefully, inshallah.
Yeah, inshallah.
Uh, so, can you tell us about the women's reproductive health
Sure.
accessibility during
Yeah,
COVID times? Yes.
sure. Which is actually something really important. I did some work for this. I had an opinion letter as well. I wrote that letter that got published. I actually worked with my sister for that. तो उसमें ये है कि we're talking about women's accessibility for contraception. और अब हम बात करें in a very very new novel scenario, which is the COVID year. The COVID when it first started, मार्च में जब लॉकडाउन मार्च के बाद शुरू होना शुरू हो गए and COVID pandemic declare हो गई थी and there were so many countries who were which were doing so badly COVID wise. So in that state of chaos and panic, um, accessibility to modern contraception for women sort of like took a backbencher. It was really sad because sorry, there were multiple barriers, of course, COVID की वजह से, but I think the cognitive barriers जो already थे वहाँ पे because they didn't have enough information, those women, और अगर थी तो didn't have enough autonomy, personal reproductive health autonomy or social autonomy or just the ability to have the decision. And then you added those physical barriers. And then on top of that, you added the pandemic barriers, जिसमें health services ही closed down हो गई. So I'm talking about those multiple countries, Germany से लेके South Africa से लेके Nepal से लेके बांग्लादेश, इंडिया, पाकिस्तान, जितनी भी family planning services की national and international organizations थी, they shut down because that was never the priority. The priority, of course, was to deal with the pandemic. इसमें जहाँ पे जो बहुत बड़ा impact आया for women who were running out of, let's say, the oral modern contraception pills or modern contraceptive injections या IUCD, which I'll talk about later on. उनको भी issues आ रहे थे because अगर एक खास time पे खत्म होगी उनकी supply, so there was a supply barrier.
Yep.
Those those centers were not having a restocking or supply of those modern contraception methods. There weren't enough doctors to deal with that because they were occupied elsewhere, of course. All the nurses and the doctors, which are able to frontliner ban chuke the. So those women, through default, they started having unintended pregnancies, and those women who wanted to have an abortion, that was another horrible scenario because as we know, abortion is a time sensitive thing. The early abortion is dependent on the timing कि जब करते हैं और and I'm talking about medical abortion. So surgical abortion तो बिल्कुल खत्म हो गई and पूरा जो आपको पता है COVID pandemic में women's accessibility reduced. So as a response in US and in Australia and some countries in the European countries first, they started working towards telehealth consultations.
How
वो
do
जब
you do
in effect आ
telehealth
गई,
for an abortion?
yeah. So for the abortion, that was a huge problem. Surgical abortion तो थोड़ी later होती है. So they started advocating for an early medical abortion. That meant UK में ही शुरू हुआ था सबसे पहले कि उन्होंने शुरू किया कि टेली हेल्थ पे शुरू करेंगे इन द फर्स्ट ट्रिमेस्टर. मेडिकल अबॉर्शन के लिए जो भी टैबलेट है वो रिकमेंड की जाएगी फॉर दैट वुमन. she'll have the prescription for that email to her, और वो लेके फार्मेसी से लेके वो यूज करेगी, and she'll be talking to her doctor online on the phone or from like as a telehealth consultation. That model worked, Saleha. That actually worked. बहुत सारी यूरोपियन कंट्री से शुरू किया, लेकिन अगेन अनफॉर्चुनेटली अब आपको पता है कि हमारे साउथ ईस्ट एशिया में वी डोंट रियली हैव अ वेरी robust network like that. Like we do have really good internet facilities, no doubt, but that concept of telehealth consultations, that was a very new thing, which a lot of the first world countries adopted quickly.
Yeah.
However, South Africa and Nepal are the models that early on to the 2020 में उन्होंने model adopt कर लिया because वो already इस पे काम कर रहे थे. तो this actually shows us कि जो already थोड़ा सा prototype इसका था healthcare accessibility का, उन country से थोड़ा सा बेहतर उनके indicators थे for maintaining the reproductive health services, but बाकी countries में it was quite a dire situation. Having said that, I'd like to draw your attention towards this fact that during the pandemic, US के अंदर आपको पता है there were 10 states जिन्होंने anti-abortion slogans करना शुरू कर दिए थे. They were trying to block the abortions for women,
I
and
have
many
nothing to
women,
say about
yeah, and it is so unfortunate that many women who actually ended up having unintended pregnancy because they couldn't access the contraception, and and they wanted to have abortion, they couldn't have it because they said no, it's not an emergency abortion. तो ये तो elective surgery में इसको लाओ या फिर इसको जी delay कर दो. It's not a priority. I mean, in
well
9 months'
9 months
time, you're
delay.
having, yeah, there's a baby coming in 9 months' time, and they were just saying कि जी इसको आप prioritize नहीं कर सकते. So it was really it's been a roller coaster ride for the reproductive health service, which actually just plummeted down globally, I would say. And that includes all the first world and the third world countries. And then eventually the countries which started doing better, Australia included, they did better because they eventually, it was a steep learning curve, and they realized that अब तो हमने थोड़ा सा अपने सिस्टम को बेहतर करना है. A, टेलीहेल्थ कंसल्टेशन को बेहतर करना है. B, मेडिकेयर के साथ आपने बेहतर करना है. C, मेडिकल अबॉर्शन को आपने ज्यादा इंक्रीज करना है. एंड डी, खातन को आप जल्दी जल्दी मेडिकल मॉडर्न कॉन्ट्रासेप्शन पिल्स और इंजेक्शन प्रोवाइड करना शुरू कर दें. और उसमें बहुत सारी कंट्रीज में फार्मासिस्ट और नर्सेज की ट्रेनिंग की गई फॉर गिविंग दोज इंजेक्शंस या जो आईयूसीडी हैं. And I can talk about those different types of the modern contraception if you'd like to.
Yeah, we'll talk about
Yeah,
that
yeah,
because I'm guessing there are there will be young women listening. Some can't talk about it openly, and
yeah,
this is still such a taboo. I don't understand why, but
yeah,
it's like women just don't have a say about their own body, about whether they want to bear a child, whether they're ready, whether they're not ready, whether they
yeah.
want a child. It's all these societal pressures that we
It
still
is
go through. That's a bit,
absolutely,
yeah, we're
yeah.
still talking about it.
We're
So,
still talking about it. Honestly, Salia, I think what really gets to me is that the fact that this this was recognized as a part of human rights was only in 2015. So it's fairly recent. It really gets to me कि इतने decades से एक बात चलती जा रही है. It's only now that we have started recognizing that a woman's right to her reproductive body is part of human rights. Yeah, it's
well,
kind of depressing at times.
it is very depressing. It is very
Yeah,
depressing. On one hand, you have women like you and me,
yeah,
uh, and others that we know. And on the other hand, we are still talking about a woman's right to her own body.
yeah.
2016 in the yeah. So
Absolutely.
so
Yeah.
okay, I have a question, and and maybe I can ask my question later. Hi, Noreen.
Hi, Noreen.
How do you hope your research will make a difference in South Asian countries where patriarchal and other structural systems work against them? Yes.
Good. That's actually a really good question, Noreen. Thank you. So yes, you're absolutely right. We're talking about these countries in Southeast Asia. जिसमें सबसे पहले तो it's a patriarchal society. It's a sorry, completely male-dominated society, which in itself is like a huge barrier. I think the only way to go forward my recommendations, which has been part of my research work as well, is that we need to start at the grassroots level. That means कि just one strategy कि जी हमने सिर्फ contraception को बढ़ा दिया is not going to cut it. That means कि we need to have a very multi-pronged approach जिसमें एक
But
तरफ
how
तो
do
हम
you
लोग
convince the men? How do you
yeah
convince
yeah
your
yeah
mother-in-law, your father-in-law,
yeah
your chacha, chachi, your neighbor? Because everybody has a say.
yeah
Everybody has a say in your life.
yeah. See,
How do you
Salia, the
convince
thing is, okay, the thing is, वही मैं बात की थी कि पॉलिसी इम्प्लीकेशन में जो मल्टी pronged अप्रोच है उसमें पहले तो हमने फोकस करना है उन यूथ पे जो एडोलेसेंट्स हैं लड़के लड़कियां 10 साल एंड above to give them sex education and sexual and reproductive health education comprising of information about the modern contraception methods. There's a reason. और ऐसी बात नहीं कि इनको आप एजुकेशन दे रहे तो जी गड़बड़ हो जाएगी. It is to provide them with the tools to understand the concept. एक तो ये बात हो गई. So this is going to be a very slow process. That means you're focusing on a 10 or 12-year-old and older teenagers जो कि अगले 2 decades में इफेक्ट आपको नजर आएगा. The other thing जो आपको थोड़ा सा legislation wise force करना पड़ेगा would be coming from the government side. तो अगर आप पॉलिसी मेकिंग की बात करते हैं कि फिर जो गवर्नमेंट की तरफ से डायरेक्टिव आएगा जो कि you need to work with ये जो बड़ी बड़ी बॉडीज हैं to talk about the policy formulations like UNFPA, Population Council, World Health Organization, all of these PSI. So the national and international organizations इनकी लॉबिंग होती है जो कि गवर्नमेंट के साथ ही लोग बात करते हैं और गवर्नमेंट की पॉलिसी अगर चेंज होती है जिसपे वो कहते हैं जी ओके लेट्स से कि जी अभी कैम्बोडिया में टेक्निकली कहा गया है कि जी मिनिमम एज फॉर मैरिज इज 18 years. वो लीगली भी कुछ years पहले बता दिए. हाउ अबाउट गवर्नमेंट कहना शुरू कर देगी जी मिनिमम एज 21 years है. तो दीज आर स्लो एंड स्टेडी चेंजेस जो कि जब इम्प्लीमेंट होंगे ऑफिशियल तरीके से वो तो आप जो बात करें कि कुछ जगहों पे जो मेन है दे नॉट गोइंग टू अंडरस्टैंड वो फिर सख्ती की जबान समझेंगे जब गवर्नमेंट की तरफ से डायरेक्टिव आएगा और अगर फाइन लगेगा. तो मैं वो एडवोकेट कर रही हूँ कि फिर वो थोड़ा सा फाइनेंशियल इंसेंटिव की भी बात करें कि जो गर्ल चिल्ड्रन हैं अब माँ बाप को बोलेंगे जी अगर आप अपनी बच्ची को अपनी एडोलेसेंट गर्ल को यू सेंडिंग her to school and you're making sure that she completes the high school, you will be compensated financially by so and so. आपको घर में आपके खाने का सामान आएगा और आपका फाइनेंशियल इंसेंटिव पे आपको उस बच्ची को स्कॉलरशिप दे रहे हैं. whatever, there are a lot of means for giving those incentives. कुछ जगहों पे मॉडल इंसेंटिव इस तरह से शुरू हुए काम and we had some really good results in countries that are
have
afterwards.
there been
And
incentives?
they've been very small, Salia. I'm not even going to quote them क्योंकि बहुत छोटे छोटे पायलट प्रोग्राम्स बने. But I honestly think कि उनको कि थोड़ा बड़े लेवल पे replicate किया जाए तो वो हो सकता है. Again, like I said, it's a slow process. So you have the legislation policy changes at the government level. अब उनको implementation भी करा रहे हैं, अब उन पे फाइन भी लगा रहे हैं, पेरेंट्स पे भी फाइन लगा रहे हैं कि अगर अपनी बच्ची की शादी जल्दी कर रहे हैं. And then फाइन लगा रहे हैं कि maybe if a couple has a child within the first year of marriage, maybe you could do that. Maybe ask them to wait for 2 years or 3 years, depending कि कितना population explosion हुआ है इस country पे. Like I seriously feel कि अगर आपकी legislation में आ जाए, because then 90% of the population by hook or crook follow करेगी. चाहे वो आप जिससे बात करी थी कि मर्द हजरात हैं, हो सकता है कि वो concept ना समझें because it's an alien concept for them. आप health education media campaigns शुरू कर दें. You're sensitizing those men in the society that look guys, this is a woman's right and this is what needs to be done. Those media campaigns need to be done at not just the national forum, this social media, internet and Facebook and all of that, but from the government's initiative as well. तो एक तरफ आपकी मीडिया कैंपेन है, एक तरफ आपका फाइनेंशियल इंसेंटिव प्रोग्राम है for parents, especially for the fathers, to ensure that their daughter stays in school till the year 18, or she managed to do some sort of vocational training for 2 years after that high school.
Yep.
That's one thing. And then the media campaign itself. And then you start other things like, I came across some really interesting information. Cambodia, Vietnam, there are some organizations like RAC and Raja. What they do is that they have started in collaboration with the UNFPA, of course, because आपको funding चाहिए होती है सबके लिए.
Of
But what
course,
they do,
everybody.
yeah. But I honestly feel, Salia, that changes occur at a smaller level, but they can, just like वो बारिश के कतरे थे, वो इकट्ठे पे मसाला बन जाता. So you need to, have sporadic policy making shifts in different countries और आपकी जो मैं पॉलिसी चेंज की बात कर रही हूँ गवर्नमेंट लेवल पे भी हो फिर वो ओवरऑल बाकी कंट्रीज के लेवल पे भी हो जो इंटरनेशनल बॉडी जो भी है तो वो तो आप बहुत मैक्रो लेवल पे चले गए बट माइक्रो लेवल पे विच आई बीन टॉकिंग अबाउट sustaining the education for girls especially, making sure that you're giving them incentive, healthcare benefits, and financial incentives to the parents. Having a policy change to make sure that the minimum age for marriage is not just 16 or 18 years, it comes up to 21 years. If you're doing that, then we can also make sure that policy making may a couple not having a child altogether, उनको fine कर दें, something like that. I know कि हर country में बहुत हर तरह के ये नहीं अप्लाई हो सकेंगे अगर हम लोग 70% भी ये पॉलिसी मेकिंग और चेंजेस अप्लाई कर सकते हैं और माइक्रो लेवल पे चेंजेस ला सकते हैं और जो मैक्रो लेवल की हम बात कर रहे हैं आई एम प्रीटी श्योर इन द नेक्स्ट डेकेड चेंज हो सकता है सी द थिंग इज जो आप बात करी थी majority of the countries are patriarchal societies of
Yeah.
course but have you it's really interesting so in these countries आपने consider किया है कि जो actual decision making है वो दादी या नानी या it's still
Yeah.
the grandma in the house
Absolutely. Yes.
it's a
So it's
big
a women
influence.
also. Yes, I
Exactly.
agree.
Yeah, yeah, and I actually wanted to Noreen ji baat ki thi. It's a beautiful question because I have feel like it always tickles my curiosity कि हम बात करते हैं power play की and then you're talking about a patriarchal society लेकिन जो decision making है वो खातून एक बूढ़ी घर के अंदर सरबराह के तौर पे she will make the decision but then her husband like the grandfather or the father would be implementing that. So we need to start from there. Like if you're having a community of women जिनकी हेल्थ एजुकेशन के बारे में बात कर रहे हैं आप इंफॉर्मेशन डिसेमिनेशन की बात कर रहे हैं तो उसमें खाली यंग लड़कियों को तो आप फोकस कर रहे हो स्कूल के ऊपर reproductive health education की but you also have community program for older women उनको बुलाइए जो 60 साल से ऊपर 50 साल से ऊपर है those women who somehow are the whisperers उन आदमियों के कानों में और डिसीजन उनकी अपनी होती है तो वो चेंज वहां से भी आ सकता है it's going to be slow process there are ways to go around that I feel के the problem जो हम बात करें कि ओ मेल डोमिनेटेड सोसाइटी है लोग हेल्प नहीं करते हैं रिड्यूस ऑटोनॉमी है ये मेजर फैक्टर्स ही कॉमन है अंडरस्कोर करते हैं in a lot of the low to middle income countries the fact is we recognize those factors now so we know what's
Absolutely.
happening
Yes.
we like I feel like we're halfway there because to understand the problem we need to know what the problem is right
Absolutely.
अब
Yeah.
जहाँ पे मसला हो रहा है सालिहा जो मुझे थोड़ा सा अफसोस भी होता है कि global political commitment जो है that has been slow, that has been lacking, and COVID year didn't really help us. It's kind of put us back. Having said that, there is a recognition that it's a problem, and it's kind of gaining momentum. The rest
But
is, but there's a but,
but
yeah. There's always a but.
there's always a but.
There's
I'm
always
going
a
to
but.
show some lovely comments that are coming through. Um, Hello, Sakib. Thank you. Thank you for watching. Wow, all the way from Japan.
Nice.
And he agrees with all your arguments. So
Thank you. I
he
really
also has a
appreciate that.
question.
See, that's the
Yeah.
thing. Yeah.
How are you going to empower women while being away from your own societies? Well,
That's a good question, Saqib.
we
So
empower the
first of
dadis
all,
and the nannies and the
are we
young
talking
boys.
about the migrant women away from the societies here? We're talking about the migrant women, right?
I'm guessing he's talking migrant
Yeah.
women because he's
Okay.
talking
Okay.
about being away from your own
Yeah. Yeah. Yeah.
societies.
Fair enough. So first of all, Saqib, I must say that we need more men like you who understand these issues. And honestly, these things start from the family. I honestly believe that the younger population, not just the millennials, but guys in their 40s and 50s, उनका काफी approach change हो रहा है. They're coming around. And like I said, it's going to be a slow process, but the younger generations and the middle-aged generations are still जो पढ़ी लिखी again education का impact होता है, but I always feel कि it's not just the education सालिहा. The education has to be paired up with the reproductive health education. तो जब तक आप किसी भी इंडिविजुअल को सेंसिटाइज ही नहीं करेंगे व्हाट्स द इशू and in the country, I'm just going to quickly touch on a topic, but I won't talk about in detail. Domestic violence in itself is a huge, huge issue. अगर किसी सोसाइटी में unofficially वो चीज endorse हो रही है, then you and I know कि उस पे आगे काम फिर नहीं होगा. Yes, there are organizations that deal with that, but I still feel that we haven't really done enough for that. So that's just one
We
aspect.
haven't.
We're
We
not
haven't.
going to go there, but the thing is, when we talk about women's rights, it's sort of like it's sort of like the umbrella term which includes everything. तो वो जो बात कर रहे थे व्यूअर साके बात कर रहे थे for how to empower women if they're migrant women. Well, I think मेरी जो recommendations है जो मैंने अपनी in the PhD thesis मैंने की थी, which have been published now, is that we need to have linking programs like health education programs in the parent country जहाँ पे वो migrant women हैं, जो कि फोकस करती हैं on just those migrant women, और उनको हम लिंकअप करें वो जो बेसिक आपके हेल्थ सेंटर्स हैं. अब हर कंट्री में आई नो कि डिफरेंट क्लिनिक्स होते हैं. यू हैव द क्लिनिक्स और द बेसिक हेल्थ सेंटर्स और जस्ट हेल्थ सेंटर्स जो बोले जाते हैं. So what we need to do is that again a collaborative effort between the national international organizations along with the government, because you need the nod
Absolutely.
from the government,
Yes,
right? Yeah.
you do. Yep.
And then what we do is we actually have a focused program for migrant women for providing them with reproductive health services. Because hota ye कि when they arrive at a new country, they can have a lot of barriers. A, they come from an educated family, but they just don't know where to go. It is as simple as that. So
Yep.
just by giving them that information that, okay, ladies, these are the reproductive health services available in this country. ये government की हैं, ये private sector की हैं, ये यहाँ पे provision होती है. You guys can go there. ये उनका contact number है, ये address है, ये email है. ये तो हो गया. Now जो बाकी कुछ खवातीन जो कि they come from maybe low socioeconomic status या उनके education level zero है या बहुत कम है, उनके लिए आप फिर focus कर सकती हैं to actually have a special reproductive health education program जो कि उनको community centers में मतलब कि उनको बताया जाए इस बारे में. Again, the same sort of like a I'd say a derivative of that program जो कि आप स्कूल हाई स्कूल्स के बच्चों पे फोकस कर रहे हैं. And that could be sort of like a linking program जिसपे आप उनको पैम्फलेट्स भी दे सकते हैं, आप उनको वर्कशॉप से बुला सकते हैं. बेसिक जो बात करें कि हाउ टू इंक्रीज द वुमेन्स एम्पावरमेंट,
Yeah.
और उसमें आपके बहुत सारे अगेन आई ऑलवेज use this word multi-pronged strategy. So we'll have to use that there as well because we're talking about some niche pockets of women जो कि एक upper stratum पे होंगी, फिर एक middle पे होंगी, फिर low पे होंगी. So we'll have to have different strategies. But the common denominator is that A, you need to just provide them information. कौन सा डॉक्टर कहाँ पे है, कौन सा क्लिनिक कहाँ पे है,
Absolutely.
कौन सी
Simple
सर्विसेज
things
कहाँ
like
पे है.
that. Yes. Yes.
Simple thing, simple thing. And then you go on further because एक तो है ना when we talk about CAP, that's called knowledge attitude practice. First आपने knowledge देनी है. सेकंड फेज में आपने एटीट्यूड को चेंज
Attitude.
करना है जो कि
Yes.
टाइम
And
लगेगा.
that. Yes. Yes.
एंड देन आफ्टर couple of years हो सकता है कि practices change हो जाए that you're focusing on. So when we talk about the KAP, you're at the same time concurrently focusing on knowledge and attitude and practice. And then you're talking about the adolescents, the youth, people in the 30s and 40s, and then the older population. तो सबका
Absolutely.
इकट्ठे साथ साथ करना पड़ेगा.
We need more. We need more viewers like Sakib. Thank you.
Oh, that's amazing. So true. So true.
And we
Oh,
also need more men like you, Sakib, to empower our
absolutely.
women. You know,
Absolutely.
one, a
Honestly,
father, a
I'm,
brother, a dad,
yes, yes,
husband, a
so true.
grandfather, an uncle. It just needs
So true.
men who will
Absolutely.
change
That's
society.
that's beautiful to know. That's really, really reassuring. We've got,
Yes.
really good people. Bilkul.
And he did say that he's not shy to say that he's a feminist. So more power to you, Sakib.
Yep, more power to you. That's amazing.
Yes. Um, so contraception,
Yep.
something we never ever talk about because we are South Asians. We are shy. These are stuff that we don't talk about. What would you like women to know? And
Okay.
times have changed. I mean, we there are women who get pregnant while they're not married. They're in a relationship. There are women who are child brides. At 13, they're not even old enough to look after themselves. Um, they're carrying a child. There are 16-year-olds.
Absolutely.
I heard somewhere in Pakistan a 12-year-old was forced to get married. I know in India this happens all the time. Rules, regulations, doesn't matter.
Yeah.
But so what
Yeah.
is the easiest way for a woman? Let's talk first. Let's talk migrant women who move
Okay.
countries, um,
Yep.
and for whom language is a barrier. They don't know where to go. Healthcare is an issue. They've come in as an international student,
Yeah.
myriad of problems. I mean, you and I
Yeah.
can go through it all night and we'll never finish. But
Yeah.
let's
I know.
talk
I
about
know.
the migrant women first
Okay.
who need contraception,
Yeah.
whether they're newlyweds, whether they're unmarried.
Okay.
Um, I mean,
Right.
many
Um,
things. Let's
I
go through
think
that first, and then we talk about South Asian women back home.
right. So first of all, I'll just touch quickly on the migrant women in different countries, उनकी accessibility का. And then you asked me to talk about the contraception, मैं जो बताना चाह रही हूँ for viewers. Okay. Because it's a huge topic. I wish we had more time to talk about it, but I'm just going to
And
summarize
we
it
will
all.
talk about it one
Yeah.
day. I think we
Yeah.
need to talk about it.
Yeah. So for the migrant women, like I said before, and you very nicely mentioned कि different language के background के साथ होता है, and not all women can communicate in the English language as well, and उनके अपनी
Yeah.
ethnic backgrounds की होती है, language होता है. I'll give you an example here in Australia. आपको पता है कि Central Link वगैरह पे या Medicare पे there are people जो कि different language में communicate करते हैं with different women, Chinese में या Arabic में. I'm just going to give you a very basic example. Like, we have started the rollout of COVID vaccine here in Australia. And before it was happening, there was this ad sensitizing people about the COVID vaccine AstraZeneca rollout. And the message, if you remember on the television, was being delivered in seven different languages. Starts in English,
Yeah.
Chinese में, Japanese में, Arabic, sorry, Punjabi में, Hindi में, all languages, जो जितनी भी basic हैं, German language, so वो सब बोला जाता है. So I think I'd like to maybe recommend the same thing to migrant women here in a particular country. You need to have interpreters, जो language communication के लिए आप use करें, and you have an information pamphlet जो basic बना आपने English में दिया. Again, the concept is the same. जो आपने information सबसे पहले देनी है कि what is contraception, ये different types हैं, ये वो सर्विसेज हैं जो आपकी सिटी में उस पर्टिकुलर सिटी में प्रोवाइड की जा रही हैं और उसको फिर ट्रांसलेट किया जाए इन couple of different languages जो कि उन औरतों को दी जाएं. So that means because those migrant women obviously are there as residents, I'm assuming, या अगर वो asylum seekers भी हैं तो they are of course उनका सारा details तो गवर्नमेंट के पास हैं. तो फिर ये सब काम जो है अगेन इसमें गवर्नमेंट की हेल्प के बगैर नहीं हो सकता. That means we need people who are working in that sector, and then we need people like me who can actually give that information, and then we need also people who are interpreters who can actually communicate with these women और उनके साथ बात कर सकते हैं. I can give you one example. Not recently, but 2 years ago, I had conducted a cross-cultural research project, जो कि मेरा part of my PhD project था, and I wrapped it up. I had to go to Cambodia and Singapore. And then I had to talk to my patients there, and I was targeting the young women and the women in the 30s for their accessibility to health and their perceived and actual barriers उनको जो लगते हैं मुश्किल चीजें लगती हैं financial हैं या social हैं या cognitive barriers हैं but also कि उनका concept क्या है जो हम बार बार knowledge attitude practice की बात करें कि उनके दिमाग में क्या बात है उनको उनकी अम्मी ने या grandmother ने क्या बताया about contraception which is again a taboo subject और practice क्या करती हैं वो. So I had to utilize two research assistants जो कि bilingual थे, जो कि English और Cambodian languages के
Yep.
में. तो मैंने
Yeah.
दो खवातीन so I selected two young खवातीन who were masters themselves और beautiful people. So इन दोनों बच्चे मतलब खवातीन ने मेरे साथ help out किया था because I was leading those research interviews and we had to communicate like आधी औरतों ने तो English में जो आपने बात की थी कि some of the women were just happy to communicate in English and they gave the whole interview in English. But कुछ ऐसी थी who only
Yeah, who
talked in
did not?
Khmer. Exactly. So I used those interpreters to conduct that interview in their own language, and then it was transcribed and translated. Similarly, जब हम लोगों ने उन्हें pamphlets दिए for information about the healthcare services in let's say Phnom Penh or Siam Reap में जहाँ पे मैं गई थी or information about the basic types of contraception. So that was translated like that was presented in English as well as in the Khmer language. तो वो चीज जो है because I know that I've done that and I know it works,
Yeah.
uh, just that sensitization. Again, I keep saying knowledge because you have to say क्या available है, उसके बाद फिर you can build up on that knowledge, right? तो यहाँ पे भी ये हो सकता है जो migrant women हैं in different countries, they should be given that information. अगर वो नहीं पढ़ सकती हैं, अगर वो नहीं है educated, तो उनको verbally सुनाया जाए. तो there are people around, we can utilize their services जो कि bilingual होते हैं और वो कर सकते हैं different languages में. तो ये तो आपके पहले question का answer हो गया. Now the second one, that's a really big one. So what I'm going to do is I'm going to just talk about contraception means any use of a method, a contraception method जिससे pregnancy unintended prevent की जाए, जो कि eventually abortion से आपको बचाती है. उसमें सबसे पहले I like to say कि I'm an advocate of using modern contraception for women. I would never endorse any traditional contraception. The big major types are modern contraception and traditional contraception. Having said that, because अब जमाना change हो गया, we are here in 2021. तो जो traditional contraception methods है, herbs or tinctures or whatever, or even calendar method, you know कि वो change हो सकते हैं. पहले नहीं था, अब वो हैं. So you can actually shift to the modern contraception. Part
So
of my
would
research,
you explain what modern contraception is?
yeah, I'm going to go for
What
that. Yeah,
are you
yes,
advocating pills
yeah.
instead of
I'm not. I'm
inserting
not.
anything?
Not just pills. No, no, no. I'm just saying. Look, first of all, modern contraception includes oral pills. They can be oral contraception combined pills, जिसको COCP भी बोलते हैं.
Okay.
फिर POP pills होती हैं progestin only pills. ठीक है. उसके बाद होते हैं आपके injections hormone. Then you can have your IUCDs, intrauterine contraceptive devices. And then we can also have subdermal implants or patches. And then the surgical procedure, of course, in males, it's vasectomy, which is a
Yes.
permanent process. And in females, it is a tubal ligation, which is again a permanent process. Now, what I'm trying to say is that we need to understand that not just one method is right for one woman. हो सकता है
Absolutely.
कि, yeah. So what I'm trying to say is that yes, I do advocate women who are sexually active within or outside of marriage globally, you know कि जो मर्जी culture हो जाए, but around the world, it's not just within the marriage. So we're talking about these sexually active women within or without the marriage. But my point is, those women need to use modern contraception if they want to avoid any unintended pregnancy. Traditional contraception method use is not going to cut it. And the thing is, अभी 2012 में unmet need की definition भी change हुई है. And I've actually recommended in one of my papers, which has been published in the European Journal of Contraception recently, and I've recommended कि हम जब बात करते हैं unmet need for contraception की, तो प्लीज आप उसमें उन खवातीन को डालें जो कि ट्रेडिशनल मेथड यूज कर रही हैं, कैलेंडर मेथड, or herb method or whatever, because there are literally anywhere from 25 to 40% chances of a woman getting pregnant on a
Are
traditional
people
method. It
still
is
using herbs?
the
Are
still,
women actually
yes,
using
yes,
herbs?
yes. I have come across my research. There are women who actually use that, and then they get pregnant, which is again an unintended pregnancy.
Yes,
And because it's a cultural thing, they say, "Oh, it happened. That's okay." So,
accident.
so the thing is, we need to understand that. Um, for the modern contraception, if it is used correctly, of course, sorry, I forgot to mention condoms. Condoms are the only method of contraception which prevent against the unintended pregnancy, and of course against any sexually transmitted diseases, including HIV, AIDS.
Yep.
So the only method which actually acts as the barrier method and the most effective, सबसे cheap, कोई उसके side effects नहीं सब, and it's really effective if it is used correctly. Again, for the oral pills, what I can tell you for the women here is that the oral contraception pills are a combination of estrogen and progesterone hormones. Progesterone is the hormone that provides the contraception, that blocks the ovulation to happen, and I'll talk about the safe days and ovulation days. And estrogen is the one that regulates the menstrual bleeding, right? In a POP pill or a progesterone only tablet, it's just the progesterone used as a contraception method. Now, these pills need to be taken every day by the women. And trust me, Sally, I've come across some women who said that, oh, they just took it for 3 days and then they just left it. They thought they were just,
I was going to
it's
ask you
crazy.
that.
Yeah, it's crazy. Some women actually have used the old contraception pills together, like teen char tablets, khali, to be used as an emergency contraception, and then they had to they landed in the hospital, and it's scary because why is it happening? Because a you've given them that information. Actually, what you know what you've given them that contraception, but you never really empowered them or gave them the information how it should be used. And unfortunately, in a lot of countries, what happens is they go to a health center or a family planning center, and they'll just be handed down those pills. Nobody would have the time of the day to sit down with that woman. Maybe she's accompanied by a teenage daughter or her sister, and nobody would tell her कि जी आपने किस तरह से use करना है, ये इसके side effects हो सकता है आपको change करना पड़े. Because see, as a clinician myself, and I've dealt with my patients back home, and then as a public health researcher, I always advocate कि okay, this is the method. It might suit you, it might not. You can always change it. जो 20 साल की एक लड़की कॉन्ट्रासेप्शन पिल्स यूज कर रही है हो सकता है वो 40 साल की औरत को ना सूट करे. So it has to be a tailor-made program. That's where the clinicians, the doctors, and the nurses, and the we come in. वो information देने के लिए. And उसपे भी I believe it's not just the patients, it's the nurses as well, the paramedical staff as well, especially in the Southeast Asian region. जिनका आपने attitude change करवाना है, जिनको आपने खुद information पहले देनी है because they have the older information. They probably don't even know about the newer versions of the contraceptive pills, right? दूसरा मैंने आपको बताया था मेथड जो कि कॉन्ट्रासेप्शन इंजेक्शन हार्मोन बेस्ड होते हैं. These injections need to be repeated after every 3 months. I can give you the example of DMPA, dextromethorphan injection, जो कि ovulation को रोकता है for 3 months. The some women are happy with that. Some women feel कि वो शायद time पे अगर नहीं जा सकती तो that can be an issue कि अगर वो 3 months से 4 months पे चली गई, then that period they've been sexually active, so they can still get pregnant.
Yeah.
So that is something to consider. And then again, they're dependent on the supply from the health center for those injections. Um, so these pills and the injections and the condoms, they fall under the SART method. They're called short-acting reversible contraception methods. Then you also have the LARC method, that is called a long-acting
Long lasting.
reversible
Yeah.
contraception method, exactly, which comprises the IUCD, which is जिसको आप coil बोलते हैं अक्सर countries में या आप बोलते हैं intrauterine contraceptive device. It's sort of like a tiny device which is inserted into the uterus by an expert physician or a nurse who has been trained in that. अगर IUCD सही तरह से इस्तेमाल किया जाए तो it is effective for 5 years. The women definitely need to be talk to their doctors, their GPs और जो भी उनकी gynecologist है. लेकिन
And is it suitable
the
for all body
efficacy,
types and everyone?
sorry,
Is it suitable for all body types and for
it
everybody?
is suitable for all body types. Yes, it is suitable for all body types. Preferably the women जिनका C-section हो चुका है उनको पहले evaluate करना पड़ता है gynecologist को. I wouldn't really recommend it as a first go-to method.
Yep.
अगर वो pills use कर सकती हैं या subdermal implant use कर सकती हैं तो maybe because C-section की वजह से there's a scarring on the uterus, so it can lead to some sort of
That's why I asked.
issues.
Yes.
Yeah. So they might not be the first line candidates for using an IUCD, but a regular woman who's sexually active, they can use that. And also then the subdermal implants, which is sort of like tiny rods, which contain the hormone, which is slowly released, और वो आपके underarm के अंदर insertion करके लगाया जाता है, and they're also effective for 5 years.
Wow.
Oh, it's just the skin. It's not deep. It's just like sort of like a tiny prick in the skin, and that's it. They just insert there. Yes, the issue is for the large methods, the long-acting methods, they're very effective for 5 years, but you need the expertise from the physician or a specialist nurse to do that procedure. Not anybody can do that, not even a regular doctor. तो ये वो सारे इश्यूज हैं जो कि आ सकते हैं, but efficacy wise these are the most effective methods, like 99.5.8% effective. Oral pills, honestly, Saliha, agar if you were to ask me what is the most effective trusted method, then it is the oral combination pills. They are
And you have to
99.9%
have it
effective.
regularly, not
Yes. Now
not
the thing
three
is,
in one day. Yep.
no. Like they have 30 pills, so you have to take one pill every day, and they maybe have sort of like a placebo pill, yeah, iron pills, so एक हफ्ते के लिए. But it doesn't matter if a woman's menstrual cycle starts or stops or whatever. They have to continuously use a full pack of 30 pills and then start the other one. So, considering the fact that if the women use it correctly, it has to be a same day. If the woman has forgotten to take her pill for the first day, she can take her usual dose the second day, but she can't do this to do इकट्ठे ले ले.
Yep.
But if she's forgotten it for 2 straight days, then she definitely needs to use condoms or maybe use some other form of contraception or just avoid being sexually active for those days because फिर थोड़ा सा उसको हफ्ता लगेगा just to come back and she can always contact her gynecologist or GP for that.
Yeah.
So there are ways to take those pills. There's a methodology, but they are very effective. So are the other methods as well.
Thank you.
Yeah.
We have Sakib here. Um, Hi, Sakib. There is no organization, Chai Chat and Community. I do this pro bono, and I am very honored and very fortunate to have people like Farwa come to my show and do this free of charge. It's just advocacy, I think, on both our parts because
Yeah.
we don't talk about these issues. So,
Yes.
yes, sorry, there is no organization. If you want to share it, it'll be on YouTube. It'll be on whichever channel you're watching from. So yes, feel free to share it because I think the more people know about this, the better it is for all of us. Then I
Yes.
think both Farwa and I have done our jobs. So if even one
True.
person is affected positively, that's it. We are happy with that.
Absolutely. True.
Hello, Humera.
Hi, Hamera. Thank you.
Um, because we are over an hour.
Yeah.
Um, I'm going to ask the last questions, and then, which is very important, is there an age to have a baby? And what are the social repercussions? We always know, for us, it's always society, community, cha cha, mama, neighbors, like I keep saying, because everybody's business is our business, and we have to have an input whether it affects us or not. So let's talk about the right age to have a baby and then what are the social repercussions.
That's
Uh,
actually such a good question. Sadia, and I like what you said, Kay. It's like everybody's business, like except the couple, it's everybody's business. And I think it doesn't
you
end
get
there. Like I'm
married,
sure,
and if in 9.5 months you haven't had a baby, oh my God, there's something very wrong with the woman then. We know it, you know it, I know it, we both know it. So, yes,
yeah. I'm going to add something to what you've just said, actually. So, yeah, if the pressure like it's everybody's business, and if the couple has had first baby, the pressure is now on the second baby. So, वो जो girl
absolutely.
facing,
And then,
the
girl,
girl
if
face,
you have a girl, then you need a boy. If
yeah,
you know,
so
the family is
unfortunately,
never complete. So it just goes on and on. Yes, there's no end
it's
to this.
crazy. It's
Yes,
crazy. There's
don't get
literally
me
no
started.
concept of
This is my pet
birth
hate.
spacing. Yep. एंड हम लोग बात कर रहे हैं उन यंग खवातीन की जिनके 3 बच्चे तो नहीं 4 5 6 बच्चे like back to back every consecutive year and it's depleting their calcium levels, their iron levels in the body. They are just literally becoming empty husks क्योंकि उनको कोई केयर कुछ नहीं मिल रहा maternal. हम WHO बात करता है कि एक औरत को कम से कम 4 दफा एंटीनेटल केयर कराना चाहिए जिसपे अल्ट्रासाउंड भी आता है सब कुछ आता है. Do you
You want
really
to
think
explain
कि
antenatal care? Because you and I
I would
know
love to?
this
Yeah.
concept is
Okay.
not there.
Okay. So yeah, and I was just going to say कि a lot of women वो बेचारी जाती नहीं है डॉक्टर के पास मतलब वो तो ऐसी if they're lucky if the baby survives तो ठीक है जी वो चले गए डिलीवरी के वक्त चले गए. Antenatal care सालिहा is the care जो कि एक pregnant खातून को मिलता है during her pregnancy. So antenatal care starts from the day she conceives and her pregnancy has been established by the blood test or by the जो भी अपने urine test करके किया है and then the first scan जो भी available है different countries के different parameters हैं to have scan on a particular day like the first ultrasound scan. Having said that, antenatal care is a holistic combination of the doctor's checkup, nurse ka, ultrasound ka, blood test ka, to screen any infections in her body. And then the most important scan जो कि इसको हम बोलते हैं fetal anomaly scan जो कि usually 22 weeks पर करते हैं और उस पे एक बेबी का पता चल जाता है कि गॉड फॉरबिड कोई एब्नॉर्मैलिटीज तो नहीं है फिजिकल या कोई न्यूकल कॉर्ड ठीक बनी हुई है न्यूकल ट्यूब ये सब कुछ ठीक है एंड देन यू टेक इट अप फ्रॉम देयर एंड जस्ट अ जनरल चेकअप अक्सर खवातीन को जिसको हम बोलते हैं जेस्टेशनल डायबिटीज या जेस्टेशनल हाइपरटेंशन प्रेगनेंसी के दौरान उनको दे वर नेवर डायबिटिक लेकिन उनको शुगर हाई हो जाता है उनका ब्लड प्रेशर हाई हो जाता है some women can land into eclampsia, preeclampsia. So these are all the medical issues जो कि avoid किए जा सकते हैं अगर उस औरत को एंटीनेटल केयर अच्छा मिल रहा है. So that's all about the general discussion about the antenatal care. आपने बात भी की थी कि what's the right age to get married. So look, I have been a big advocate in prevention of child marriages. I feel very strongly towards that. I wish there are more people like us to talk about that. Marriage is a beautiful, beautiful thing, but it has to happen at the right age, right? एक तो ये बात होगी. And then the right age to have a baby. So जब एक बच्ची खुद एक लड़की छोटी है 15 साल 16 साल 17 18 19 she's still a teenager. वो अभी भी पढ़ रही है and she's carrying another baby. और यूजुअली होता है मैंने आपको एग्जांपल दिया था कि 18 साल पे उसके ऑलरेडी 2 बच्चे होते हैं और थर्ड प्रेगनेंसी चल रही होती है. That's the case unfortunately in a lot of the regions around the world. There are disparities, urban, rural, of course. ये ज़्यादातर regional areas या rural areas से ज़्यादा होता है. Cultural repercussions भी इसकी आती हैं. But the thing is कि technically, I would advise a women to at least wait till 24 years, honestly, because that's the adolescence and youth. Or जो भी अगर उन्हें, if they really want to go for a baby, please go after 25 or 26 years. If they really want a baby, that is. Again, because it has to be a personal decision and then a couple's decision. जो हम सबसे पहले हमने बात शुरू की थी for talking about gender equity and gender equality and human rights and then personal autonomy. Um, the good age to have a baby can lie anywhere between 25 years to 38 years. Um, Technically, World Health Organization um, gives you the age group between 15 years to 49 years for adolescent girls and women in which they can bear a child. So that's called a childbearing
49.
age. Yeah,
49.
yeah, yeah. It used to be 45 years actually. A decade and a half ago, they actually increased it to 49 years.
Wow.
So, yeah. So
That for
technically,
me sounds all wrong then. Because at 49, by the time your child is 20, you're
yeah,
69. You really
yeah.
can't do much, can you?
See, but the thing is, Talia, you must have come across cases regional areas में या Southeast Asian countries में कि 18-20 साल की बच्ची है बड़ी और she's expecting her firstborn
And the
and
mother's
the
also
mom is
expecting,
also
yes.
expecting another
We've
child.
been
But
talking
it happens,
about
yeah.
this,
So
yes.
yeah, so we need to break that cycle. It's happening because, again, remember I mentioned the unintended pregnancies. I can guarantee you that 90% of those pregnancies are unintended. Not one pregnancy is planned. और ये बड़ी अनफॉर्चुनेट बात है कि इन खवातीन को कॉन्सेप्ट ही नहीं है कि अनइंटेंडेड प्रेगनेंसी क्या है, लेट अलोन टू यूज कॉन्ट्रासेप्शन. There have been cases. I was reading some research work from Thailand and Cambodia and Vietnam. जिसमें abortion, surgical abortion, जो कि unofficial तरीके से की जाती है, इसमें औरतें मर भी जाती हैं. That abortion is actually used as a contraception means. Like, would you believe that? मतलब चूंकि उनको पता ही नहीं था कि कॉन्ट्रासेप्शन के क्या क्या तरीके हैं, and when they started having a pregnancy, they just resorted to a botched abortion
Yeah,
surgery,
I've heard of
which
that.
cost them their life probably or some disability or something else. It's really unfortunate. और इसमें सॉरी आपने दफा migrant women की भी बात की थी. A lot of the migrant women जो कि in search of job जाती हैं country to country or rural to urban areas in these countries, they're marginalized women. So they are poor women, they're less educated, and they're marginalized. They're vulnerable women. They live in factories या garment factories में जिस तरह रहती हैं या hostel में रहती हैं इकट्ठे. उनके पास funds नहीं हैं. If they're lucky, if they get married, they have zero autonomy and they will have a string of children. So that is that one group जिसको focus करने की हमें जरूरत है in different countries. So the right age to have a child, like I said, could be anywhere between 25 to 38 years because after 38 years, technically, the chances of having medical issues in the woman do increase, of course. Pregnancy, hypertension raise हो सकता है, gestational diabetes हो सकती
Yes.
है, Down syndrome की chances बढ़ जाते हैं for women who have their babies in their 40s. तो वो सारे factors consider करने की जरूरत है. But having said that, there is again, it's not sort of like a formula
Not
जो आप किसी को
written in
पेश कर
stone.
सकते हैं. But if girls want to have a baby, then yes, maybe the mid to late 20s is a good age, maybe 30s is a good age. There's nothing wrong with that. And because हम बार बार बात कर रहे हैं autonomy की, तो I would advocate girls go get please focus on your education, focus on your career. Yes, get married. Yes, go have a baby if you want to, but have it at the right age at which आप उसका ख्याल कर सकती हैं. अगर आप खुद बच्चा हैं तो फिर बेबी का क्या ख्याल ख्याल हो सकता है.
Thank you. I hope everybody's listening to it. some truth in it. We'll talk about the referral services. I think I'll just, because it's country specific, I'll
Yeah,
try and put this the referral services for reproductive health in
yeah,
the when I put it up.
yeah.
Um, and let's end with Noreen's message. I wanted to ask you about your published research papers. Do you want to
Oh,
talk about
very
that?
shortly, very shortly. Okay.
Okay, here she is.
So, oh, thank you, Doreen. Thank you.
This
Really
is
appreciate
Noreen.
that.
You're my
Thank you.
amazing.
Thank you. So, Salia, I'm really happy to tell you that by the time I finished my PhD earlier this year, I have had eight publications in Australia from Monash platform, where I worked at a clinical trial. And then my last five publications have been from Beacon. This way, I have been working for similar topics because I've been focusing on reproductive health. So I was working on unintended pregnancies and factors associated with unmet need for contraception, qualitative and quantitative projects पर मैं काम करती रही हूँ. So they're all published at the so we call it Q1 journals. They're like the top ranking academic journals. As you know, PhD is a very cutthroat sort of world, so you have to be really at the top for because
Yes,
when I got published, it was a big thing for me because that meant that I could actually use my published recommendations and results for the stakeholders back in Southeast Asia, and actually was sending them my published papers. Because अगर आपने छोटा सा भी डेंट कहीं डालना है, जब तक आप publish नहीं होगे, nobody's going to listen to you. So that really, really mattered to me. But I'm very happy that all of that work has been published there. My last paper was published in the Taylor and Francis Journal. It's a very academic, niche sort of journal for contraception. And there's another one, PeerJ, that's a US based journal. So I think for us to make our mark in the academic environment and to be published in the topmost sought after international journals is a little bit difficult, but it feels really good when it happens.
congratulations.
Thank you.
On that note, we say goodbye today. Thank you so much for your
Thank
time.
you.
And
Thank
this
you.
is
Very
really
welcome.
very,
You've
very
been an
interesting.
amazing host, can I say, because
Oh,
it felt
you've
more like
done all the
chatting to a
work. I'm
friend.
just smiling. Thank you, Farwa. Thank you so
Thank
much.
you. It's been my pleasure. Thank